People rely on their cars more and more these days, and a question I frequently get asked is, when can I drive after my vein treatment? Well, to some extent it depends on the treatment that you're having, and this is what I advise. So for example, if you're having the VenaSeal procedure, that's where we use a medical superglue inside the vein, or if you're having the Clarivein procedure, you can drive yourself pretty much straight away. That means you can drive to the clinic and drive home or back to work straight away after treatment. That's because we use very little local anaesthetic. In fact, only just one small local anaesthetic jab per leg. In the case of VenaSeal, there's no bandaging or stocking to wear, and in the case of Clarivein, we use only a medical stocking and no bandage. So I've known people who have driven themselves to the treatment and then driven back home or back to work straight away afterwards. Now, if you're having sclerotherapy and it's your first treatment, I usually advise that you don't drive straight away and that you have somebody bring you to the clinic and drive you home again. Now, the reason for this is that very rarely sclerotherapy can cause a migraine, sometimes with a blinding headache and with visual symptoms such as flashing lights in front of the eye. Now, it only happens very rarely, and in my experience it usually only affects people who suffer with migraine anyway. It's never permanent, it only lasts a few minutes and it occurs immediately after treatment. But I wouldn't want you to drive home with a migraine or shortly after recovering from a migraine. Now, of course, if you've had sclerotherapy in the past and you've not had a migraine, then I'm very happy for you to drive yourself to the clinic and drive away, both after foam sclerotherapy and after microsclerotherapy for thread veins. Now finally, if you're having an endovenous treatment such as laser, I don't advise driving straight away after the treatment. I recommend that you have somebody bring you to the clinic for your treatment and then drive you home. The reason for this is that we typically use quite a lot of local anaesthetic, and we do often put a firm bandage on your leg with a stocking over the top. Now, this doesn't inhibit your ability to walk, but it might affect your ability to do an emergency stop. The following day, if you feel comfortable and you're able to do an emergency stop, then you can drive. But check with your motor insurance company that they're happy to cover you for driving in such a circumstance. Now remember, these are my guidelines and you should always take the advice of the vein specialist treating you. I myself sometimes modify this guidance to my patients if they're having a lot of vein treatment to both legs at the same time, or if they're having combination treatments. Well, I hope you found that useful. My name is Dr. Haroon Gadraj. Thank you for watching.